Senator from North Carolina.
Mr. President, I look around this chamber and I see the busts of many vice presidents who served as the leader of this chamber. And it makes me wonder, what would they think of the process that we're currently engaged in? Individuals at a time in our history of this country took so seriously what went on in this chamber and the effects that it had on the American people. And I look at the process that we're going through right now and see the way we have trivialized this process. Votes in the middle of the night. 24 hours ago, there was not a manager's amendment. There was not a score. Then we, yesterday morning, got a manager's amendment, 380 some pages, and we got a score. Today, we get a notice from the Congressional Budget Office saying that in their score they made a $500 billion error. A $500 billion, $500 billion error in the projection that they sent to Congress. 24 hours, $500 billion. Now, why doesn't this seem to bother those that are the authors of the bill? It's because it's not their money. It's the American people's money. And that's the only way that you could rationalize how you could be in Washington talking about spending $2.5 trillion at best to stop waste, fraud, and abuse. Because let's face it, Republicans and Democrats agree. There's no health care reform in here. There's a coverage expansion, but there's no health care reform. Democrats have walked to the floor and said we lie. I'm not lying. Show me the health care reform. Show me where you have drastically changed, transformed health care. You transform health care, then you wouldn't have to steal $464 billion from Medicare.
Yield.
I'll yield to you when I'm through.
Yield, so
I'll yield to you when I'm through.
I can show him all the health care reform that's in this bill.
President.
The senator from North Carolina has the floor.
The senator doesn't want to learn about health care reform in the bill.
The senator from North Carolina has the floor.
I appreciate it, Mr. President. We've gone through this and we're refused the ability to offer amendments. We're refused the opportunity to sit in the back room where the legislation's constructed. It's shared with us when they're ready. But they use everybody's money. Tell me how that's fair to the American people. When Nebraska gets a sweetheart deal under Medicaid, and Massachusetts and Vermont in the manager's amendment, when Nebraska is told, we're going to expand Medicaid and we're going to hold you harmless in perpetuity, you will not have to pay. Tell me how that's fair to the taxpayers of Virginia. Tell me how it's fair to the taxpayers of Ohio. Tell me how it's fair to the taxpayers of North Carolina that they're going to pay for what Nebraskans should be obligated to. And I believe, knowing Nebraska, that the people of Nebraska would want to pay their share. But no, to buy a vote, they've been given a deal. Well, this bill is still $2.5 trillion. It still steals $464 billion from Medicare. It still puts a tremendous unfunded mandate on every state in this country, with the exception of the state of Nebraska. There are a number of states that have a grace period for some period of time, whatever it took to get their comfort level of their vote. But for every other state, at some point, they're going to be obligated to pick up that difference. We cover 31 million Americans that weren't covered. That is a wonderful thing. And 15 million of them are dumped into Medicaid, the worst health care delivery system that exists in this country. A health care system that only has the opportunity today to see 60% of the available doctors because the other 40% won't see them. And oh, by the way, what did the chief actuary of the Centers for Medicare and Medicaid Services say? The Reid bill is especially likely to result in providers being unwilling to treat Medicare and Medicaid patients, meaning that a significant portion of the increased demand for Medicaid services would be difficult to meet. Chief Actuary went on to say the CMS actuary noted that the Medicare cuts in the bill could jeopardize Medicare beneficiaries' access to care. Now, I just heard the senator from Rhode Island basically come out and say that that was a fabricated thing on somebody's part on this side of the aisle. I'm quoting the chief actuary, the president's chief health care budgetary person. The actuary said it could jeopardize Medicare beneficiaries' access to care. He goes on to say he also found that roughly 20% of all Part A providers, hospitals, nursing homes, etc., would become unprofitable within the next 10 years as a result of these cuts. Hospitals will close, nursing homes will close. This isn't fabrication. This is the chief actuary of the Centers for Medicare and Medicaid Services, who is part of this administration. The CMS actuary found that further reductions in Medicare growth through the actions of the Independent Medicare Advisory Board. This is the advisory board that's being set up to make determinations about coverage in the future, and the chief actuary said, which advocates have pointed to as a central linchpin to reducing health care spending may be difficult to achieve in practice. In other words, it's not us that's making claims that aren't right. It's the authors of the bill that are making claims that aren't accurate, according to the chief actuary. Minority Leader?
North Carolina, if that were not bad enough, and it may have been referenced here on the floor before I came out, we have an announcement from the Congressional Budget Office just today that may well have been referred to by my friend from North Carolina. This is the Congressional Budget Office Director's blog today. And here's the headline: Correction. Regarding the longer-term effects of the manager's amendment on the Patient Protection and Affordable Care Act, CBO has discovered an error in the cost estimate released yesterday, related to the longer-term budgetary effect of the manager's amendment. They go on to say that they were about $500 billion off in looking at the long-term effects beyond the 10-year window, which further illustrates why we ought not to be rushing this thing through. And we ought to have further opportunity to discover what other problems there are in it, in addition to the ones the Senator from North Carolina is outlining with regard to special treatment for some states, which all the rest of our states have to pay for.
Well, the minority leader makes a great point that if we waited another day to vote, we might save another $500 billion. That's probably in the best interest of the American taxpayer. And I want to wrap up, Mr. President, because I know Dr. Coburn wants to speak. Let me just say this, that I said earlier, this still steals $464 billion from Medicare. It also still raises taxes and fees to the tune of $519 billion. Many of those taxes and fees, by the way, are going to impact people well below the $200,000 threshold that the president promised he would never touch. And we've just learned in the manager's amendment that we've dropped the doctor fix. Now, they should be comforted in knowing that they've got 2 months extension, but the 1 year extension was dropped in the manager's amendment. Dropped. Why? Because they had to pay for what they were doling out to get extra votes. So I would ask unanimous consent at this time, Mr. President, to set aside the pending amendment, and I would like to call up Amendment 3134, which is a 3-year doctor fix of the SGR. Ask for its immediate consideration.
Is there objection?
Mr. President, for the 6th time, we're engaged in this stunt. That's why I object.
Objection is heard.
Well, Mr. President, my hope is that no other member from the other side will come to the floor and say Republicans haven't come up with substantive amendments to this bill. Dr. Coburn and I participated in 56 and a half hours of the Help Committee. We offered numerous amendments. Some technical amendments were accepted. The amendments that meant anything were rejected on party lines. We have had filed as a bill, Comprehensive Health Care Reform Bill, the first one introduced in Congress, May of this year, I believe, Dr. Coburn. Yet, still members from the other side come to the floor and say Republicans haven't offered anything. We were the first. They may not have liked it, but we were the first. And you know what? It doesn't cost this, and it doesn't raise taxes. And I think Dr. Coburn later on will talk about that bill a little bit. I was glad to see that politics comes from all sides. In the manager's amendment, we dropped the tax on Botox. Hollywood really spoke out about this tax on one of their health care tools. And what did we replace it with? We've now put a 10% tax on tanning salons. How in the hell does that affect health care? Explain that to me. Are we going to tax everything in this country? I can make a tremendous case that the 10% tanning salon tax gets exactly the person that the president said he wasn't going to affect, people that made under $200,000. Or are we income testing the tanning tax too?
Would the gentleman yield for a question?
Happy to yield.
If we're going to tax tanning salons, why aren't we taxing anybody that goes to the beach? Because true sunlight is much worse for your skin than a tanning salon. So if the intention was to prevent disease, why wouldn't we tax it where most of the diseases occurred? Or how about kids' sports in the summer? Let's tax kids' baseball or swimming. Let's tax all the swimming pools because we're going to have exposure to UV light. I mean, it shows you the precariousness and the silliness of a large portion of this, and I yield back.
Well, the gentleman makes a great point, and I'm sure that we have loaded the chairman of the Finance Committee with additional good ideas that he could go back and think, and I'm sure before it's over with, we'll find parents that don't put suntan lotion on their children, and especially if it doesn't meet a high enough SPF to block everything that the sun might produce. This is out of control. This is not the way to write a bill that affects 1/6 of the U.S. economy. I mean, it's bad enough that it's done behind closed doors in a back room with only a few people there, that the number 2 Democrat can walk on the floor and say, I haven't seen it either. Well, you know what? If the number 2 Democrat hadn't seen it, how many people were there? How many people's input came into this? Was it just Leader Reid and Senator Nelson? Was it the presiding officer from Minnesota? Nobody knows. Nobody knows. But the truth is that what we do know is that the American people don't like the process, and more importantly, the American people don't like the bill. Now, Chairman of the Finance Committee, others have said, but once it's out there and they get a taste of this, they're going to like it then. Let me remind my colleagues, it's too late. Chief Actuary already told us hospitals are going to close, nursing homes are going to close, doctors are going to quit practicing medicine, doctors are going to quit seeing Medicare and Medicaid beneficiaries. How do you repair that after you've done the damage? Are we willing to risk that for the future of this country and generations yet to come? Boy, we got a few hours, 10, 8, before we vote. I hope people get some sense. I hope they pull back from this. Let's leave for Christmas. Let's think about this. Let's go home. Let's talk to people. Let's listen to people in this country. If we do, we might come back, get a new piece of paper, take some of the things that are in this bill, take some of the things we have talked about on this side of the aisle, take some of the stuff the American people have talked about. Find a way for 100% of the doctors and nurses and hospitals to survive. Find a way for 100% of the American people to have coverage. Not 31 million that are covered in this bill and leave 24 million outside the scope of coverage. You see, I think when we set out on this, we had 3 objectives. It was to cover all the American people. We flunked. It was to invest in prevention, wellness, and chronic disease management. Doctor and I would both say we haven't come anywhere close to doing that. And the third one, and the most important, was make sure it's fiscally sustainable. CBO, CMS, wherever you want to go. The only way this is fiscally sustainable is if the independent Medicare Advisory Board continues to cut reimbursements, the scope of coverage, to meet how much we're willing to spend on health care to say it is affordable. I don't believe that's reform. I believe that's legislation that picks winners and losers, and that's not the role of the Senate of the United States. Yield to the good doctor.